Every time I meet a new patient is different. I really do feel like it's a privilege to come in and meet someone, and that's one of the nicest things about working on oncology is to be able to get to know that person as an individual at a time in their life when they're facing probably the biggest challenge they've ever had. I'm Linda Hazelgren, nurse practitioner at Hematology Oncology Associates of Fredericksburg. I wanted to be a nurse from the time I was about 3 years old. I was a critical care nurse for well over 20 years prior to going back to school to become a nurse practitioner, and I knew that I wanted to have a position where I could really interact well with patients. I knew that palliative medicine was becoming more and more of a specialty, and it was something there that I wanted to focus on. And so in oncology, you get kind of a unique opportunity to be with someone from the time they get a scary diagnosis all the way through their treatment. The physicians at HOAF are just really wonderful to work with. They're approachable, they're wonderful teachers, they're very respectful of physician assistants and nurse practitioners that we have here. It's a place where you really feel valued as a professional. Palliative care is like an extra layer of support for patients that have serious medical illness, such as cancer. It's an opportunity to focus on how that illness is affecting you as a person and your family, and to see if there's anything we can do to help you process the changes that are happening in your life. We address pain and symptom management, sleep, anxiety, lack of appetite. Fatigue is a huge one. In palliative care, we also focus a lot on long-term planning and what we call illness understanding, which is you met with your oncologist and you got a diagnosis and you started treatment right away. What did you understand about the goal of that treatment? Is this something we can cure? Is this something that we're trying to give you more time and improve your symptoms? If this is an incurable illness, then what is the end of your life going to look like? Goals of care, living wills, those kinds of things. In order to access palliative care at HOAF, you just request a visit with the palliative care nurse practitioner. Visits are typically about 45 minutes on Tuesday mornings. They can also be scheduled at other times throughout the week if Tuesday mornings don't work. Over time, the vision is to try to open it up so that we'll have palliative care appointments available every day. We do try oftentimes to combine it with other visits so that there may or may not be an extra copay when you come in. That would be really the only cost. It's covered through insurance, just like any of the other visits that you have when you come for treatment here. HOAF has a patient support group that meets on the third Tuesday of every month, and usually we have a speaker. It's a pretty nice, tight-knit group. They enjoy hearing from specialists and getting that information, but I think by far what they enjoy the most is the opportunity to speak with one another. It's really hard to overstate just how awesome cancer patients are. They have a strength and an openness and an honesty that really is kind of inspirational, and they get a lot of inspiration from one another. I really am excited about growing palliative care at HOAF, to be able to offer it more comprehensively and more frequently. I think it's just wonderful that now there's such an emphasis nationally to provide palliative care as part of good comprehensive oncology care. In my years as a critical care nurse, I really saw that medicine was losing the personal touch, and palliative care is a way to try to bring that back in again.